I devoted most part of my active career days to reporting health, and for me it's using the media as a strategic tool to contain, to prevent, to speak, to give information, and also to educate people about diseases. Well, the inspiration started on a very sad note. I lost my mother to an accident, and because we didn't have availability of how best to treat her, she was hemorrhaging internally, and they couldn't do anything to save her. Conjuala and cancer control, I've lost friends to cancer. Then it hit me so close home. I lost my auntie who looked after me and looked after my children and my home to cancer. Even this year, my adopted sister lost her husband to cancer. So for me, advocating for palliative care, affordable care, and ensuring that people who are sufferers of cancer don't have to die. We have survivors, and we should have many more survivors. So advocating for cancer care would always be a priority for me. I'm so pleased to speak to Project Pink Blue. I remember that when you started as a little embryo that has grown into what we have on the international scene, that I was part of it. And you know, there were many curves, but you have been able to weather the storm, and I'm truly proud of Project Pink Blue. The kind of commitment that they gave to this project, you know, just gives hope to the fact that if we do it ourselves, we do it better and we can do it more. So I just want to say it, particularly to the young ones, that you also have a role to play in cancer control in Nigeria. Project Pink Blue has shown the way.
The founder of Breast Cancer Association of Nigeria, an NGO at the forefront, galvanizing action against breast cancer in Nigeria. Well, Breast Cancer Association of Nigeria, BRECAN, came into being after my experience with breast cancer in 1997. When I was diagnosed, I didn't know anyone that had the disease. I was shocked when I got to the hospital. There were quite a number of women in the ward at different stages of the disease. Right there, before I could even get treated, I made up my mind that I wasn't going to keep quiet. I'm glad to be, and I'm proud to be on rooftop and shout, I'm a survivor, and so that people will ask me, how did you do it? And I will tell them, one, awareness, information, understanding the disease you're battling with, you're dealing with. And that's one of the biggest problems we have in Nigeria, in our environment. When we move around with this awareness in the church, in the market, or radio, TV, and so on, we talk about it. Awareness is the key. Awareness is the key, is the entry point to surviving this disease. And whether you're a well woman, you must pay attention, because you never know. Breast cancer does not discriminate. It's not a matter of you cover the blood of Jesus. It does not work here. Quote me. It does not work here. I've been in this thing for 21 years, over 21 years. It does not work, and we must recognize that we are human beings and we are susceptible to diseases.
Well, first and foremost, before I came to the Senate, prior to that time, I didn't know much about cancer. But before coming, I met friends, colleagues who talked about cancer, having lost loved ones, and some talking about moving people to India. Why must we be taking our patients or cancer patients to India? What actually is cancer? So we're educated on what cancer is, the ailment, and how it can be curtailed, and the treatment. So I sat down, got some people, and said, okay, if that is the case, why can't we put a bill together to set up a cancer treatment center that will be complete, that will be comprehensive, where we'll have people trained, where we'll have people screened, where we'll have people treated. But I want to thank God that eventually it became a reality, because it went through the preparatory stage, went through the gazetting, went through first reading, second reading, third reading, with amendments here and there, but eventually it was passed and approved. Project Being Blue, you have been creating awareness and letting people know, assisting people. We want to collaborate with you and other CSOs so that we continue to raise the awareness, not only awareness as regards treatment, but as regards detection, and also getting the National Assembly and the executive to implement this program and project by appropriating funds and also making sure that those funds are released. You can help us to act like a pressure group, because we need also to be sensitized more. Yes, it's become a law, but it needs to be become an act. It needs to be implemented.
Health is a basic human right that is not in dispute. When at least 80% of our people are able to access quality, affordable care within a short distance from where they live, then we say we are there.
That all Nigerians have access to health promotion messages. We have recently gone into partnership with the Federal Radio Corporation of Nigeria, using both its network and FM radio stations to actively disseminate information across the nation. In order to reach the grassroots levels, jingles on cancer awareness have been developed in major Nigerian languages such as Hausa, Igbo, Yoruba, as well as speech and English language.
We want to make sure that our children get immunization, our babies survive, our children grow, and that we don't have to suffer. People will complain quite often that Nigerians go late to hospitals. Those with cancers go there late. It's because of poverty. Treat yourself the way you treat your cars. Some people are trained to look after your body. See them. We have a program where for you to fly a corpse back to Nigeria, you must get a waiver from the minister. And since I became minister, I've been documenting why do we lose them. 50% of those who die outside this country die from cancer. And that's why we've made cancer a key program.
Daily we get so many letters from people with either cancer, kidney problem, liver problem, too many, and most of these people just cannot afford to pay the bills they are being given by the hospitals. So I think a few years back we just decided as an organization to see in what way we could help them. Unfortunately we cannot give them money, but then we decided to give our airtime, of course, which is also money. We've had cases of those who we put on air and they were able to get the exact amount, or at times even much more than they required, who went for the surgeries and also came back to us to say thank you. Please let's help. Some of these monies we take out to go eat lunch, to go eat dinner. There are people out there who need it to keep alive. So please don't stop helping. Let's keep helping. And the good Lord, who is the greatest helper, will keep helping all of us. Project Pink Blue, a big thank you to you, Ronsi, and your team. We've worked together on some of the cases they've had to handle, and we've assisted in putting some of the patients on air. You've been wonderful. I think one of the first things that attracted me was seeing a young man who was interested in helping people. You don't find too many of your type, so I must say a big thank you to you and congratulations for not giving up.
But what we need are educated, passionate nurses to help the families deal with that. Breast cancer is a very treatable, and if caught early, a very curable disease. Navigator is someone who will be available to you to educate you and help you navigate and get over those barriers. True or false, wearing a bra increases your chance for cancer? False. Oh, you guys are smart too, you're beautiful. No matter how many years of training we could have 20 years of education. When it's your loved one in that bed, or who's just been diagnosed with cancer and they think they're going to die takes any bit of knowledge you have and throw it out the window.
We did 4 solid days of extensive training on patient navigation in respect to breast cancer. And we had many professors and doctors and a psychologist all come and talk about palliative care and dealing with patients with the diagnosis of cancer.
Oh, well, did Miss Lori tell you about taking care of your drains at home? And the patient goes, no. They're like, what? I spent 10 minutes with them and taught them, but they didn't get it. So we got to make sure that the words we're telling them, they are hearing. Promote early cancer screening and detection and save lives. We can. Comfort them and bring them peace of mind. We can. Be a cheerleader and support them as they fight the big fight. We can.
Call on all individuals, corporate organizations, to join hands, with the government in checking the menace of this disease. I sincerely hope, and pray that together we can really make it. And as legislature, we're really going to do our best also, towards supporting the government in ensuring that we reduce, to the barest, minimum, the number of deaths being recorded by this scourge of cancer in Nigeria.
I'm the founder of a non-governmental organization called RAISE Foundation. RAISE Foundation is an acronym for Reproductive Health Rights. We have 3 major interventions that we work with, the first one being maternal and child health. And under this maternal and child health intervention, we have a breast and cervical cancer prevention program. And through this program, we have been able to touch the lives of women and men, actually, in Niger State, where we are based and where we have started our work. However, we actually help cancer patients all around in Nigeria. We have conducted several screening exercises aimed at detecting early cases of breast cancer and cervical cancer. We have found that early detection is one of the best ways of survival from breast cancer. So that is why we've concentrated on early detection. Project Pink Blue, I have to say, is doing tremendously well in the cancer space with the support of patients. Cancer, it's a very devastating illness that has catastrophic effects on families, especially financially. And part of the work that Project Pink Blue performs is giving support to these patients, and I think it's a very admirable thing. They're doing very well, so I would want to congratulate Project Pink Blue for their initiative and their hard work, and commend them, and I would like to recommend everybody to support Project Pink Blue in what they are doing to help cancer patients in Nigeria.
Egobege Cancer Foundation was founded in 2006 after the death of my mother, who died in 2006 from breast cancer. It wasn't a decision I made because I wanted to raise awareness, but I had no choice in the matter, as my mom, who was sick, was actually more interested in setting up a foundation. It became more important than the disease, because in talking, maybe one person will hear and one person will go for screening. So what came out of her, the period of her sickness, because she was sick for about 3 years, and then she passed, was early detection could save your life. So when she passed, the day of her funeral, we didn't see it as a day to cry. We saw it as a day to do the one thing she asked, that we tell the world about this, that cancer can be prevented, and that some cancers are preventable, and that cancers can be treated. And we began to preach the importance of people coming out to be checked. Do not wait till you find a lump or something that you are not going to be able to manage before you go and see your doctor. So we now went to rural communities to educate the women You can talk about cancer, you can encourage people to go and be screened, but then when they come back to you to say that it's positive, that they have cancer, what would you do? Do you send them away? And knowing that these people are not people of means, we ended up looking for ways to raise money. You know, we started raising money to treat people. Time I met the founder, Ronsi, you know, I was like, oh, young man, this is good, you know, and he's driving it with the stamina of a young man, and it's good.